Thank you. Yes, ma'am. All right, let's call the City of Milton Common Council meeting to order Tuesday, January 3rd, 2023 at 6 p.m. And can we get confirmation of appropriate meeting notice?
Meeting notice was posted on December 29th at Milton City Hall, Hometown Ace Hardware in Milton, Piggly Wiggly.
Is there a motion to approve the agenda?
Second.
There's a motion and a second. All those in favor? Is there anyone opposed? That motion carries. Okay, Larry will do the Pledge of Allegiance. His hand found its way to his heart. Public comments regarding items which can be affected by council action. Are there any presenters signed in? Not presenters, public.
There is not.
Seeing none. Okay. Meeting dedication. So tonight there is a proclamation regarding International Holocaust Remembrance Day. I am doing the dedication to start off the new year, and I am dedicating this meeting in memory of all the Holocaust victims, their survivors, and their family members. So we dedicate this meeting to all of them. All right, proclamation, Holocaust Remembrance Day, January 27th. Whereas International Holocaust Remembrance Day is held on January 27th of each year, it is a day for the world to pause and remember the millions of people who were murdered or whose lives were forever changed by the Holocaust. And whereas in 2005, the United Nations adopted a resolution rejecting any denial of the Holocaust as a historical event, either in full or in part, and condemning without reserve all manifestations of religious intolerance, incitement, harassment, or violence against persons or communities based on ethnic origin or religious belief whenever they occur. The resolution also designated January 27th, the anniversary of the liberation of the Auschwitz death camp, as an annual international day of commemoration in memory of the victims of the Holocaust. And whereas member states of the United Nations are encouraged to develop educational programs to install the memory of the tragedy in future generations and in order to help prevent future acts of genocide. And whereas City of Milton joins with all whose lives were affected by the Holocaust, we remember their strength, courage, and bravery, and we will continuously work to make sure their stories are remembered. Now therefore I, Anissa Welch, Mayor of the City of Milton, do hereby proclaim January 27th, 2023 as International Holocaust Remembrance Day in the City of Milton. All right, our second proclamation is regarding Human Trafficking Prevention Month, which is January, and our chief has been actively involved in this public service awareness and prevention campaign, and we appreciate all his dedication and efforts that he has made over the years and continues to make. Human Trafficking Prevention Month, January 2023. Whereas the problem of human trafficking is enormous, with traffickers exploiting an estimated 24.9 million victims worldwide. And whereas traffickers are motivated by money, and human trafficking has estimated profits exceeding $150 billion per year. And whereas anyone can be a trafficking victim, human trafficking includes forced labor and sex trafficking, and it affects children and adults, citizens and visitors, women and men, and girls and boys. And whereas the average age of initial human trafficking entry into the commercial sex industry in the United States is 13 years old, and whereas traffickers often tailor their tactics to the unique vulnerabilities of each victim, they can lie, isolate, control, intimidate, beat, torture, and abuse. And whereas cases of human trafficking have been reported in all 72 Wisconsin counties, and whereas the Rock County Anti-Human Trafficking Task Force was established in the spring of 2017, their mission is to develop and maintain a community network that serves to educate, prevent, and respond to victims who have been or are at risk of being trafficked. Now, therefore, I, Anissa Welch, Mayor of the City of Milton, do hereby proclaim January 2023 as Human Trafficking Prevention Month. Okay, so we had some pretty heavy-weighted proclamations and serious ones, and they are worthy of our time and consideration and acknowledgement of the seriousness. One thing that the City of Milton did a couple of years ago, I guess, when we applied for the Drug-Free Communities Grant, and we received it, and we now have the Milton Youth Coalition that is working towards prevention efforts in a collaborative manner with other community coalitions and Rock County's prevention network to do the good and necessary work of prevention. And this evening we have some very esteemed guests, including our own Maggie Kasicki, who will be joining us this evening for a presentation. And I'm going to let the other ladies introduce themselves and share a little bit about their background in like 2 seconds or less.
Yeah, the rest of the agenda question. Approval of minutes and
Oh, I skipped right down to the presentation. Sorry. All right. Approval approval of minutes
Motion to
for
approve.
December 20th, 2022.
Motion to approve the minutes. Second.
All those in favor?
Aye.
All those opposed? Discussion and possible action regarding the bid evaluation for cleaning, repairing, and painting the elevated reservoir west tower.
So this is an item that's been kind of in the works for the last couple of years. We budgeted for it partially in 2022 and partially in 2023 through the utility funds. We'd like to move forward with awarding the bid to Classic Protective Coatings in the amount, of $619,375 to perform that work hopefully later this year. And in a future agenda, maybe as soon as 2 weeks from now, we will have a funding mechanism, or at least outline how this will be funded during this year.
Al,
Yes.
I was just wondering, I'm not sure if we have anything leased on the top of that tower over there, but if we do, are we responsible for that prior to this work?
There's a number of items on top of the tower, including Rock County 911 emergency response, and we have been coordinating with them to make sure that they have temporary locations during this time. In terms of the private entities that are on the tower, we have the right to have those temporarily removed and then returned, and so Mark's working with them as well.
Thank you.
Any other questions or comments? Is there a motion?
I'll make a motion to approve the bid of $619,375,000 for J.R. Stelzer Company for the tower painting.
Second.
Nope, it would be with, classic protective coatings in the amount of $616,950.
Oh, I'm sorry, you're right. I pulled that one off. The motion would be to approve classic protective coatings with the amount of $216,900.
$616,950.
600, yes. Got it. $616,950.
I will second that.
All those in favor? Anyone opposed? Okay, now we can move on to the agenda item that I wanted to do first.
Do we want to move
Yes.
down there? And then I guess the question for
Yeah.
you is, do we want to continue to record it?
Don't we have to?
I don't know that we have to.
Yes, we should.
Okay.
And then did the presenters, they have the microphone
Yep.
down. Okay, all right, so we'll move to the seats. I can't believe I just skipped.
Okay, so, hi, thank you for having us. I'm Becky Huber. I'm the Coordinator Prevention and Community Engagement for Rock County Human Services. That is a new role to the county. I've been in it for a little over 2 years now. We receive federal funding in the form of a block grant, and 20% of that federal funds have to be spent on prevention. It's part of the grant requirements. So for many, many years, the county contracted those services out into our community. And about 2.5 years ago, they decided that we were going to look at more of an upstream approach and see how we could be more partner more with our community, be more collaborative, and be more connected to our prevention efforts. So that's when I started in this position. So my main piece of my job is to work with the active coalitions in our community, as well as communities that don't have coalitions. So I'm part of the Prevention Network, which is made up of the Milton Youth Coalition, Building a Safer Evansville, Youth to Youth in Beloit, and JM4C, Janesville Mobilize for Change in Janesville. At this time, the only one of those coalitions who have an active drug-free community grant is Milton. So we are very excited that they were able to bring that funding into our county and into the Milton community. All of those efforts are to work on prevention of substance use amongst our youth, and also to provide education and information to families. So if we reduce risk in our communities, we have a higher probability of people not coming into our system and not having to use some of the services that we provide at Human Services. So it's a very long explanation, but in that role, I also do a lot of harm reduction. So we're talking about Narcan today, and I'm able to partner with community organizations like Addiction Medical Solutions. I always call it something else. And other places like Vivent Health and other organizations that are working on harm reduction and getting that education and information out in the community. So I will hand it to Erin.
Wait, microphones. Anyway, okay. So I'm Erin Howell. I've been doing harm reduction and prevention for quite a few years. Okay. And things have changed quite a bit over the years. Initially, a lot of what I was doing, it was working with people who were like in active addiction. I did syringe services. I did a lot of different things that way. Our landscape has changed significantly. A lot of the folks that we're seeing who are coming in contact with opioids, who are experiencing overdoses. So I shared some information with you all. One of the things that I shared was the overdose report from, I think, month of November for Rock County. And if you look on that, you can actually see a snapshot of what we're looking at for like the month. And then you can also go back in the years. And I always like to share this with folks because sometimes people just assume that people who are coming across opioids are people who are, you know, out on the street and accessing things illegally. If you notice, we've got several men above the age of 85 that are probably coming across things, and whether it's in like a skilled nursing facility or, you know, at home with dementia, different things. So just to kind of point out that it looks very different. We've included a lot of different resources for you all as well. The one thing that has changed significantly, so Becky and I had the opportunity to go to Atlanta, was that April? And the DEA was there, which was really, really important. It was really interesting for us, well, me personally, I would say. But one of the other things that I included was the emoji drug code, and they shared that with us. And so that's another thing that is changing quite a bit. I don't know how many people have kiddos, but unfortunately, those things are happening with kids too. So there's lots of different things that affect.
Before you start?
Yeah.
Before she starts in her presentation. Oh, some local statistics that we wanted to share before she started was, you know, the opioid epidemic started about 20 years ago. And just like all of other things that we have progressed over the years, all those universal precautions and all those prevention efforts and harm reduction take a lot of time. And we're really seeing a huge push. When we were in Atlanta at that conference, whether you were doing the prevention track or the harm reduction track or the treatment track or recovery track, the conversation was around fentanyl. Fentanyl in our drugs, fentanyl in our street drugs and pills in all different places. So, and then what they were saying is that fentanyl is here and it's killing more people than any other drug. In Wisconsin, more people die of overdoses of some type of opioid than die in car accidents every year. And in Rock County alone, we had 64 deaths from opioid-related overdoses last year. Was it last year? Yes, it was last year. And we are higher than the state average for opioid deaths, for overdoses. So that's why we feel that this conversation is so important, because it isn't just illicit drug users. It also is family members who come in contact with medications or mix up their medications. There's a lot of reasons that someone may need to use Narcan that are not just for those using illegal substances on the street. So, and I know that I had no idea what Narcan was and what it could do and couldn't do until about 7 years ago. And I've worked for the county for 25 years, and I was in youth justice for many, many of those. So I know it's a conversation that just continues to have to happen in every area. And the hope is that you'll share this information when you leave tonight also with someone that you love, or someone in your family, or someone in your neighborhood. And I'm sure every single person in here is thinking of someone that they know that may need this information. So now I'll give it to you.
Okay. And one other thing before I get too far into that, so another thing that Becky and I do, well, any of us in the prevention network are doing. The red boxes, those are overdose emergency kits. You may see them out in your community. Those are available for folks to take the Narcan if they know somebody that might have a prescription for an opioid, or they might need it. It's also for emergencies. We also have the AED. So we have magnets and stickers that you might also see, those on the AED boxes, especially in newer buildings where they don't want to add the box to it. So those are things that you probably will see quite a bit in the community. Because it's just like having a fire extinguisher in your building. Hopefully you'll never have to use it, but it's there just in case. So quickly, I'm not going to go through all of this stuff. Learning how to use Narcan is very, very simple. It's very simple. You all, I believe, have copies of my slides. And the reason that I distribute those is so you can go through and look at those. Again, with opioids, it's really important for people to understand that they can be natural or synthetic. Unfortunately, one thing that we are seeing quite a bit of is pills. So you can actually get like a pill press on Amazon, and you can, so fentanyl, again, we talk about fentanyl, it's extremely inexpensive. So having fentanyl compared to going to a pharmacy and getting that prescription, it's very inexpensive for someone to create a pill that looks just like the pill that you would get from the pharmacy. So making sure that people understand that that's out there as well. I know, I got to do this in half an hour's time. I know, I don't want to. So a few things to really take away from this information on here. The effects of Narcan. Narcan is only good for 60 to 90 minutes. Unfortunately, with opioids, depending on which type of opioid you have, that person's tolerance or anything else, it can have an effect anywhere from 3 to 24 hours. So a person can absolutely overdose multiple times from one time. So they might take one pill, and if that Narcan, reverses that opioid overdose, and it happens to be a longer lasting opioid, they can overdose them multiple times. So it's very important. We are always making sure that people understand that they need to call 911. I included the Good Samaritan laws in there too, so if in case anybody had any questions on that. But the huge part of that is having EMS there, because if you have one box of Narcan that has 2 doses in it, you use your 2 doses, boom, boom. Then what are you going to do? Say an hour later, 2 hours later, they experience another overdose, and you're out of Narcan. If you haven't called to get them help, that could be a problem. I'm just going to jump. But go ahead. I love the visuals. For me,
it's just really important.
we'll go back. I'll let Becky share this. I like the little
Okay.
takeaway of the brain.
I'm also,
We'll tag team.
yeah.
Please, any questions you have?
I just want to say it's so proud of you to present that idea of 24. Because
It
we have a lot of patients in my clinic that
Well, and there are people that go to the hospital, and they're under supervision at the hospital, and they experience multiple overdoses. Yeah, absolutely.
So opioids bind to the receptors in your brain, triggering that release of dopamine, and the neurotransmitters they're linked to learning, pleasure, reward. So when someone starts to use an opioid, they continue to use the opioid because they have those sensations that happen. So over time, it actually changes how much they need to use, how often they need to use that. It also changes the way that their brain works, right? It changes your wiring, so to say.
I always like to share this one so you can actually see. So this is what a cutout of your brain would look like. As you're introducing an opioid into your brain, your receptors, those opioids are going to fit just perfectly on there. Too many of those opioids fit on those receptors, and that's when you start to experience an overdose. Just some examples of prescription opioids. Again, those are in the packet if there's anything that you have questions about. But another thing that Becky and who else are you working with on that, with the doctors in the community? So we're working with other doctors who are prescribers of opioids to make sure that folks get Narcan as well. Because too many times people are going home with an opioid prescription and they don't have access to Narcan. So that's one thing that the county, so that's happening as well. But anyway, Some illicit opioids, pretty much common sense. We've already talked about that. Heroin seems to be the one that people identify immediately. Any type of non-pharmaceutical or fentanyl. It does look very similar to heroin. Okay. So this touches on the DEA. We mentioned this as well. They are doing a huge push with one pill can kill, making sure people understand that anything that can be laced. So this tiny little grain is how much it takes to actually kill someone. So just so people are aware that you need to be very careful not taking things from other people. Like that's a conversation I have with my kiddos. Not taking aspirin from your friend because you don't really know if it's aspirin. Like go to the school nurse, do all the things that you're supposed to do. This was extremely concerning. In August that the DEA shared this, and then again right before Halloween they shared it again. I know people are super skeptical, like nobody's going to be giving out free fentanyl around Halloween, but unfortunately sometimes this is marketed towards younger folks. This I also like to share. So if you're looking at those vials, a person who normally would experience their high, they'd use about that much heroin. If you're looking at fentanyl, it's significantly less. So if they have no idea that it's fentanyl and they're using that same amount of heroin, but it's really fentanyl, you can see how it could be fatal. The carfentanil, which is actually an elephant tranquilizer, we did see quite a bit of it in January of last year, right? January, February. That one is about a grain. Like it's boom, just like that. And super scary. So, and it's out there, unfortunately. I'm not here to scare people. I just want to make sure people understand what happens. So getting into an opioid, an overdose and what happens with the toxic amount. It can be if you're mixing benzos, cocaine, alcohol, anything with an opioid. So what happens obviously is respiratory failure, lack of oxygen in the blood, your vital organs can fail, you can lose consciousness, experience coma or death. Yeah, sure. I would say almost none of them know that they're overdosing. That whether people know if they are experiencing an overdose. So I would say most people do not. Like I said, I used to do syringe services, so I worked with people in active addiction who would use illicit substances regularly. When I would bring them back from an overdose, they would have no idea that it happened. They had no idea. Correct. Yeah, and so depending on what it is, where they're getting it, who they're getting it from, like most people, so with an opioid, you're gonna experience no pain, euphoria, like it's gonna be like the best, most relaxing, like it's a good situation. And then when they're coming back from that overdose, they're not feeling well, they're feeling sick. So yeah, it's very jarring for a lot of folks when they're coming back and they're waking up from an overdose, not knowing that that's what they experienced. So a few symptoms or signs that are pretty obvious. So unresponsive or unconscious, a lot of times that's referred to as on the nod. So if you might have a conversation with people, I've had this happen quite a bit, where you're talking to somebody and they just kind of nod out on you. It's almost like they're just too tired, they can't even finish a conversation. If you're not able to get them to come back and start talking to you, engage with you, it's pretty likely that could be a sign that they're overdosing. Their breathing can change depending on how close you are. You could hear the shallow or slow breathing, or might see that they're not breathing at all. Again, depending on how close you are to the person, you might notice that their pulse is changing. If you hear the loud snoring or gurgling noise, it's something called a foam cone. It's actually foam that comes from your lungs. It's almost like if you put too much soap in your dishwasher, it kind of just comes out. That is like the death rattle almost, like a weird. Yeah, absolutely. Yes. Yeah. And so that's another thing that, I don't know, did you bring any masks? I can get masks. If anybody is taking Narcan, I encourage people to use the masks, because depending on how comfortable you are, if you're doing CPR or anything where you would come in contact with someone, couple different reasons, obviously, if they're vomiting, or if they may have fentanyl or anything like that, and you don't want that. You don't want to be doing mouth to mouth. In that case, the risk is much higher. The telltale sign, if they're starting to turn blue, obviously, they're not breathing at that point. Okay, so naloxone is the actual medication Narcan is the brand name, but we tend to use them interchangeably. In most cases, I think Narcan is the only one that I see out in the market. I've not known that I've seen anything besides Narcan. There are several different doses. We have the 4 milligram. Those are the ones that are out in the boxes as well in the communities. We did see 8 milligram, but I don't know how they work. I can tell you, like, so from going from intermuscular, so when people are getting injected with it, as opposed to using the nasal, it works a lot quicker in my opinion. But people tend to be sicker when they're coming back from it. So,
Can you explain how, like, so when I was trained, explain how Narcan used to be administered
Sure.
and how it is.
Sure. So the nasal is so much easier. The intermuscular, so with that, it comes with a vial. There's a packaged needle. You actually have to drop the air in the needle, put it in the vial, then it pulls up, and then you inject it in whether it's your thighs, your glutes, or if a person has a big enough arm muscle that you can get it in there. I think many years ago, it used to be like injected right into the heart area, but that's been a long time. But again, there's so many different ways that if you're injecting it, so I can tell you I had a person, actually 2 people, where I started with nasal and it wasn't enough and I had to go move on to injectable. And for me, it was like, you're fumbling, you don't want to poke. If you don't know who that person is, you also don't want to come in contact with, there's so many different risks. With nasal, it's literally, if you know how to use a nasal spray, it's really all that it is. It's super easy. When you open up the packages, this one I've used before, so that's why the bottom fell out. Yours would not do that, I promise. So each box has a little flip out here and little reminders, steps 1, 2, 3, just to remind you. And each one has the little foil packaging, and it looks just like this. So when you open it up, fingers on either side, thumb on the bottom. This plunger has been already obviously used, so it's right up here. You're going to want to work with gravity. So if you have somebody who's sitting up in a vehicle or, sitting up in a chair or somehow upright, you want to get them as flat as possible. Don't slam them down on the ground or anything crazy, but get them flat. And then go ahead, fingers on either side, thumb on the bottom, right up the nose. So your fingertips are going to touch the bottom of the nose, or you can touch that cartilage in there, just like that. It's that easy. It's super, super easy. So again, as opposed to unwrapping a needle, sticking it in there, like it's so much easier. And we'll get into really quickly. So again, the reminder, 30 to 90 minutes. It can wear off that quickly. It is safe for children, pregnant women, and pets. So I get that question quite a bit. So say, for example, somebody has an opioid prescription, the pill falls on the floor, their dog licks it up, eats it, overdoses. You can absolutely use Narcan on your pets. You absolutely can. The top of this is super small. So like if you had like a kitten or something or a cat that had a tiny little nose, it might be a little challenging, but it still would work. With a dog, normal sized dog, it's gonna be fine. No side effects, you can't get high on it. So if you have someone that you've already used Narcan on, or you know that someone has used Narcan on them, you don't have to use more Narcan on them the next time. So does that make sense? So like say for example, Becky had to Narcan me and I need Narcan again. She doesn't have to use more. It's like a clean slate. Does that make sense? So it's really specific to what that person's tolerance is, what they're using, whatever they've come across. It has nothing to do with whether they've been Narcaned before. Okay. Doesn't have any effect on someone who hasn't taken opioids. So I might see somebody who looks like they're having a seizure. Well, to me, I think, oh, they're overdosing. Maybe they're actually just having a seizure or some other type of medical emergency. If I administer Narcan to them and they don't have an opioid in their system, there's no effect. It does nothing for them. So like for me, I don't use opioids, and I've more than once, you've seen me, I've sprayed my Narcan just to show you how easy it is.
The dosage is the same?
Yes.
Throughout the synthesizer?
Correct. There's no way to do like a half dose or anything like this. So from the perspective of people who use opioids illicitly, they will say that they get sicker with nasal. They prefer the intermuscular. But to me, I want them alive. Like I want to save someone's life, so I don't really care if you're sick. Sorry, you're alive.
And if you use one dose,
Mm-hmm. Yes, absolutely. Yes. So I'll jump ahead really quickly. This is just gonna show you your brain, what it looks like when naloxone's introduced into your body. So Narcan or naloxone, it is absorbed through the mucous membranes. I forgot to tell you all that. So the person does not have to be breathing. It gets absorbed, yeah, super easy. I'm gonna, again, with winter, make sure that you keep it at room temperature. I'm just gonna skip really quickly to, so they're recommending, this is very specific, but again, there's never anybody that comes back from an overdose that says that you didn't open it the right way and it didn't work or whatever. So, it's so silly, but they have to teach us the right way. So I need to train you that you need to wait 2 to 3 minutes in between, okay? I would say, in the case where, say you know that Grandma Sally has an opioid prescription, and you know that it's absolutely from a pharmacy, and she absolutely overdosed on that, and you know you administer Narcan, and she's not immediately breathing, probably could wait that 2 to 3 minutes. If you have somebody who, one, you don't know what it is, or you think it could be an illicit, especially fentanyl, for me, I was opening it immediately and doing it again. Until, like, they're immediately gasping for air. You know immediately that it's working.
Can you talk a little bit about the term illicit? But what's the difference between illicit and
So anything that is a prescription that's being prescribed by a doctor and then they're going to the pharmacy to get that, that is licit. So that is legal. That is something that they're allowed to have. However, unfortunately, we know part of what we do in our communities is the safe drug disposal. We have the lock boxes. We have, twice a year we do the prescription drug take back days as well. So it does happen where things are, you have something from the pharmacy, it's prescribed for that person, but somehow it gets into other people's hands. So that can happen. We try to do everything we can to prevent that. If it is illicit, so in that case, it's illegal. So that means, like, whether it's, if you're talking pills, for example, that could be coming from someone who makes the pills. It could also be from, so this happened quite a bit. So again, I've been doing this for quite a while. Before fentanyl was as big as it was, we would have people who would take pills. So say, like, I don't know, Percocets or whatever. They would take Percs and then they would crush them up and they would mix other things with them. So that would expand, and then they would do the pill press. So now typically fentanyl is cut with everything. Like, literally, I mean, we see fentanyl with meth, we see fentanyl with cocaine. Like, it is everywhere. But yeah, so the difference between the illicit and licit is really just legal and illegal. But unfortunately, even if things are obtained legally, sometimes they fall into the wrong hands. So another thing that we've been really pushing for is, like, veterinary clinics, when they're giving out prescriptions for your pets and you're not using that entire prescription, make sure you're disposing of them, not leaving them in the house, because who knows? Who knows who's gonna end up having those? But okay, so again, reminder, the 2 to 3 minutes, if that's what is recommended. Me personally, when the folks that I work with tend to be using illegal drugs, and so I know that I have to be ready to administer more than one dose, and usually have to. This is what the intermuscular looks like, so you can see it's a syringe and the little vial. And they do have that available at Vivint Health, so if anybody would prefer to have a syringe, we can always get that for you. So rescue breathing is something that we teach with DHS. However, every time I've ever called 911, they told us to do CPR. The other thing that goes with that, so part of the Good Samaritan law, it is not required that you administer CPR. You do not have to do that. You have to administer Narcan and call 911. That's part of that. Those are the ways that you're going to save somebody's life, but you do not have to do CPR or rescue breathing if you're not comfortable with that. Especially when COVID was happening, people were not, they were not doing that. Recovery position, I'm just going to teach it really quickly, just because it helps if you happen to be the only person there and you're with that person. They recommend to put them on their left side and have the leg bent. Actually, I think this one shows you a little bit better. So you're actually turning, the knee is bent, so it supports the body, so they can't roll forward or back, so they're not going to, choke on their vomit or anything like that, or flip over on their front. Okay, so again, reminders, people might be physically ill or vomit. Okay, so when you're administering the Narcan, you're down there, you're doing that, I would take a step back as soon as you start to hear them breathe, okay? Because they may, I mean, people throw up, that's what happens. There are times when people are agitated and upset. Typically, people are just so tired. Like, you're literally waking, it's almost like waking up from a crazy nap. Like, most times I'm there when, again, people are using illegal drugs, illegal substances, and the police are there. And again, they're not like getting up and running away. I've been told in different situations, particularly in the jail situations, where people are much more agitated, but typically if it's somebody that you know, they're not going to be that upset. They could have a seizure. It does happen. It's very rare. I've never seen that happen, but it can. They can overdose again. Again, making sure they're not taking any more opioids. I have all these in here for you guys. So I'm going to just jump really quickly to carrying naloxone or Narcan. Again, all you have to do is administer the naloxone the way that you were trained, and then call 911 to make sure that they are safe. So pretty simple. Another piece of the Good Samaritan law, which again, this depends on the population that you work with. There are some folks that weren't calling 911 because they were on probation parole. That all falls into that. Oh, yes. So it does not absolutely, yes, sorry. It is included in that information, but yes. So it is absolutely, I mean, if someone were to be there, be present with drugs on them, it's not going to affect their probation or parole status. So they're not going to go to jail because they call and get help for their friend. There may be things depending on, again, it's unique to the individual, if they have warrants or other things, I don't know. But again, that depends on what's going on with them. If it's just them there calling 911 to save that person's life and after administering Narcan, no, absolutely not. And typically I would say the people that I know of that were charged in the city of Beloit, they actually went to jail for being present at the scene. The judges threw it out. So like they spent a night in jail and then went home. So yes, they possessed other things. Yes, absolutely. So the state of Wisconsin does have a standing order for Narcan. So literally anyone at any time can go into a pharmacy that does have Narcan. You can get it. However, we do have access to it. Maggie's got access to it. Becky does. I do. Anybody that needs it can get it for free. We'll give it to you. If you go to the pharmacies, you will pay whether it's your copay or however it works with your insurance. If you have state insurance, it is free. But just so you know that is an option. Yes, so 36 months. So it does last for 36 months. So if you happen to take a Narcan and you don't use it and you want to swap it out, just let us know. We can do that for you. Again, I kind of skipped over it, but keeping it at room temperature is the best. So if you happen to leave it in your vehicle and then you bring it into room temperature, I give it about an hour before it's going to work the right way, whether it's hot or cold, either way. But try to keep it room temperature. It works best that way. All right, let's see. We touched on lock boxes, proper disposal. One thing I want to make sure people understand, and I think this also ties into the suspected opioid overdose reports that we see, making sure that your doctors are aware of if you have any type of breathing problems. So you have sleep apnea or you have asthma, anything like that, make sure they're aware of it before they prescribe you an opioid, because that can absolutely affect you. You're going to be at a higher risk to an overdose. It can, absolutely. And you definitely, it's just, I mean, I would hope that your doctor would know anyway, but it's a good reminder for them. Also, don't mix any drugs. Don't mix alcohol with your medication as well. This is really just my last little piece here is some over the years things that people have laughed and thought it was, ways to reverse an opioid overdose. The only thing that works is naloxone or Narcan. So obviously you don't want to, put somebody in the bath or shower. They can drown. There's all kinds of silly little things. Okay. These are, oops, I went too fast, sorry. Different sites you can go on. You can look at things. Rock County actually has a really nice site now. It's been updated. They do, I think, monthly. It might even be less than that. It might be 3 weeks. I don't know. they update all kinds of things. So there are many different things that are happening in the community that keeps us updated, so we know what's happening out there. If there are alerts as well, so if there's certain things that are happening where we're seeing like concentrated areas where a lot of people are experiencing overdoses, those alerts are going out as well. Dane County does that too, which is really nice.
That's on the public health. Rock County Public Health has that. Oh, sorry. Rock County Public Health has that dashboard and information, and they'll be able to send out alerts. They've been working diligently to be able to get more up-to-date information out into the community.
That's it. That's it, class.
You want to talk about
I was just gonna say, so we do have, just really quickly, I was gonna say, in the sheriff's department, we do have a Narcan vending machine now, which is super awesome. I pulled those numbers. Sorry, I can't read with my glasses on. So just for example, so part of that vending machine, we have zip codes on there. So when somebody comes in to get that free Narcan, they have to enter what zip code. Hopefully people actually know their zip code. We've got it identified by city, zip code and all that good stuff. But just for example, so we had 10 people from Milton access Narcan. And then we also, I have the data for the surrounding areas as well, which is really interesting. But we gave out 211 doses. This was as of last week. So,
December 17th?
oh yeah.
Yeah, within the first 2 days.
And the fact that it's at the sheriff's department. So you think about all the barriers that people are nervous and freaked out about going there, and that many people have actually accessed it. Which is super, it's amazing. It's really amazing. And we have hopes to get it in other places in the communities too. Sorry, I stole it.
Who's in working with local physicians? Today, my patient, Larry, I just need to tell you.
Right. So that's part, one of the programs that I listened to was from Kentucky. And what they are doing is they are providing, when someone is prescribed an opioid, they then provide them with, they do a little screen. They do a 3-question screen to determine risk at the pharmacy. And then they provide a Dispose RX packet, which is something like this, Deter RX. We didn't bring any of the little ones. They look like a Crystal Light packet. Yes. They provide that with the prescription as well as Narcan. And then someone follows up with them. So that is a pilot that we're hoping to work with pharmacies in Rock County. So you've probably heard about the opioid settlement funds that are flowing into states and counties, and Rock County is participating in that and will be receiving funds. And you were asking about public health. Public health is taking the lead on the opioid settlement funds. They presented a plan at the county board in September, I believe. As of this moment, we've not received any funds that I'm aware of, but many of the pilot programs that we're working on for harm reduction and prevention are things that the opioid settlement funds will likely be able to fund in the future and keep that momentum going, such as saturating our community with Narcan. So Narcan to an opioid overdose is CPR to a heart attack. It's a life-saving measure until help comes, right? It doesn't mean that you're going to fix that overdose. You're not gonna be able to change the behaviors that led to that overdose. You're not going to be able to change the history, but you are providing that life-saving measure. So the more that we can provide Narcan in our community, we have the script. We're moving towards it. We have more Narcan direct providers that Human Services, myself, and Brenda Endhoff, who is the coordinator of substance use disorders. We both were just trained as Narcan direct providers, so we will be able to start doing some of the same things that Erin is doing. So we have more trainers in our county. We rely heavily on Erin and Vivint Health to provide Narcan trainings to everyone that we can. Yes, I'll let you. Okay. Yes. So you have, don't forget that. I was just going to say, we have these overdose emergency kits, which, there are several different kinds. There are many different kinds out there in the community. There are 32 places throughout Rock County that these little red boxes, and there's other ones called the Oak Box, that have Narcan in them. They also have the training on how to use Narcan. It also has resources in it. So we're, yes, yes, you have one that you can put in. Mm-hmm. So many years ago, we wouldn't even be having this discussion. It wouldn't be an open discussion, right? So we've come a very long ways in a very short period of time. So we have these Narcan boxes, we have the take back events, we have Datura bags available, we have a walk-in clinic that's open, we have medical assisted treatment facilities and clinics in Rock County. We're working on different pilot programs throughout Rock County and with different agencies. Talking with the schools about making sure that the nurses are able to have Narcan available to them. Mm-hmm. Mm-hmm.
Right now, we don't have any that physically have the boxes in them yet, but I think
Mm-hmm.
a big change. I was just gonna say really quickly, so, in February, we are going to be working with, EMS, so part of the grant funding that we have, we're working with the health department, we're gonna be doing these, leave behind kits, so it's gonna have Narcan, it'll have fentanyl test kits, which is different things that I brought here too, all kinds of good stuff that'll be left behind with resources and different things for folks. So the EMS, any first responder, so basically anybody that could come in contact with someone who might be experiencing an opioid overdose will have that information. So that will be happening in all of our communities within Rock County, and that's a pretty big change. Like honestly, in the last 3 to 4 years, the changes that have been made are significant. So I appreciate you guys listening to us. It means a lot just to have those conversations. So anyway, that's all I got. Any other questions? Yeah?
Yeah. I did meet with the pharmacist recently in November, and we started having these conversations from at Mercy about how we can start to partner, and they're working their end, we're working our end. We're very hopeful that we will have some really strong partnerships going forward. Public health is working on those things as well. We're all working together. There's a large group of people that meet. There's a lot of different meetings throughout the months, but we meet regularly and share ideas and different projects that we're working on. So
I brought Narcan in case anybody wants it, so it's here.
yes,
I don't know.
you never know when you might need it. I actually was in the. Yes, you were all trained that. Mm-hmm. And this is from the state of Wisconsin, so. Yes. Those are lock boxes. Yes. So, and we have more. I know that Ashley, do you have any at the?
I don't have any lock boxes. I have some alcohol bottle locks.
Okay, I can bring you lock boxes.
Yeah, that'd be great.
So, one of the things that our grant does provide is providing lock boxes to a lot of different places. We provide them to all over the county, and it reduces access to prescription medications or other things that shouldn't fall in the wrong hands. It's a really easy way to make a deterrent. And they're free. Yes, they are free. So we have that. We have the Disposer X boxes. We do have a copy of the Good Samaritan laws. We're working with, we worked with the company, or we still are, called Vital Strategies. They're based in Washington, D.C., and their job is to help states and counties and different municipalities implement harm reduction strategies. So when we ask them about these boxes, the overdose kits, like there's no policy. And they say you don't need policy because there's a standing order for naloxone. Anyone can carry it. And so we're like, okay, so what about the Good Samaritan laws? So they made us a cheat sheet. And essentially they had their attorneys go through the Good Samaritan laws of Wisconsin and gave us a sheet that we can hand out. So people know what that means and if they have questions where they can go to get those answered. The Dose of Reality site for the state of Wisconsin is a great resource. You can see anything that's going on in our county and throughout the state. There's a dashboard as well. So it's not if it's happening here, it's when it happens here and what can we do to try and prevent it and how can we provide as much information, education, and all of these things throughout the community. So.
The new CDC data that
Oh yeah.
that just came out.
I'll
What
let
I
you.
found was interesting in there is that it's the overdose information on teenagers and that died from overdoses had somebody did not have Narcan or the ability.
Not being educated. So there's multiple cases where we've seen kids on college campuses where they're literally in the same dorm and this person is experiencing an overdose and they're dying again right in front of them because they're expecting some big dramatic thing to happen where they're just falling asleep. Like they're just not, there's nothing that's like, oh my God, I'm overdosing, you know, it's just quietly falling asleep and that's it. Yeah.
College age and above, we hit the market hard with Narcan and education.
That information and that summary I emailed out to all of you.
Maggie.
Right?
Yeah. Um,
They know where to find you, right?
yes. We're happy to have more people. Every person.
Even just a conversation.
Yeah.
It's
It goes.
a huge
then
difference.
You go home and you have that conversation. They go and have that conversation. So it just keeps it going.
And there's participating in and sponsoring.
Yes, at Charla's. I'll let you. Do you want to discuss? Are you okay with that?
So our next one is January 25th from 6 to 7 p.m. at Charlotte's Coffee Stop. Charlotte participated in the Narcan training in November and was really interested in hosting one, so now we will be hosting January 25th.
So if you have a business and you want your business, any of your employees trained, we will do that too.
Everything's free. Narcan's free, the training's free.
Yeah. We have started
Everything's
to-
free.
Churches, any.
We've done that actually.
Yeah.
We,
May he present it to them.
I have a question.
Yes.
Misunderstanding out there in the community. I was drinking a lot, so Bob passed out because of his alcohol use. But they don't understand or can't connect that Bob also took some purpose.
there can be, absolutely. So it's really important for people to understand that Narcan is only effective for an opioid overdose. Okay, so like if someone happens to use, let's just say methamphetamines, and then it also is laced with an opioid, and they're experiencing an opioid overdose, but then also having, you know, all the other things from the methamphetamine, that the Narcan is only going to reverse that opioid overdose. It's not going to help somebody who's drinking too much. But again, like you're saying, people who are mixing, so whether it's pain pills with their alcohol or whatever, that increases your risk. Absolutely. Yes, could potentially. Right. Yeah. Yeah, because you won't hurt anybody by.
Can you talk a little bit about how
The fact that we're here.
because
I mean, really, truly, like Becky and I've been doing this for 2-3 years together, working on this.
in comparison to how we treat
I'm going to use my analysis. I say this all the time. Yeah, you've heard me say this before. That's why you're saying this. So, if someone has been drinking and they crash, and somebody rolls up on scene, and they do everything they can to help that person, they don't ask them, they don't care that they've been drinking necessarily, because they've been drinking isn't going to change the care that they get. However, in our society, stigma has caused people to think, you're using drugs, I'm not going to help you. When in reality, they have the same effect on our brains, alcohol and other drugs, right? Some are more addictive than others. Some cause more problems than others. So we're asking people to give people a chance, right? If you don't administer the Narcan, somebody may not have a chance to make a different choice next time, or to get the help that they need next time. But our culture is very different here, right? So we're working on those stigmas to reduce that stigma that if you're using this, it's okay. If you're using that, it's not. So that's just part of this. But we're having these conversations, and this never would have happened. 10 years ago, no way. 5 years ago, maybe a little. Now we're really talking about it, which is really important.
even though you've overdosed and you're
Still matters.
as someone
Mm-hmm.
else that maybe is an alcoholic that
Mhm.
had problems or passed out or
Right.
that has a heart attack that isn't taking care of themselves, or somebody that has diabetes that's not
Mhm.
their sugar.
Like when you go to the doctor and they say lose weight, and you don't, right? Every time you go, you should, yes, someone should still help you, right? So, yeah.
Right.
Yeah.
And I have a feeling that happens quite a bit,
Yeah.
honestly, if you look at the reports. One quick thought that I had, just so you know, so if you come across anybody in your lives, your world, whatever, that is on medically assisted treatment, so anybody who is being prescribed, whether it be methadone, Suboxone, Vivitrol, anything like that, that is used to treat an opioid use disorder, the one thing that's super important for you people to understand is that just because someone is on an opioid blocker, so something that would block them and not have them experience that high, they can still overdose. Okay, so that's something that has amazed me over the years, that people don't understand that just because you're taking something to block that high, that doesn't mean that. So they'll take more of it, thinking that they're going to get that high, and then they're going to experience an overdose. So it absolutely can happen. Correct. Correct. Yes. Yes. So it is very important for folks to realize that if you do have someone in your world, or someone, whoever that might be, addressing their addictions, or, in recovery, and then just know that that's a risk. So that's all I got. Okay, sorry. I could talk all day. No? We appreciate you guys.
Thank you.
All right, all set? General items. Committee reports. What do you got? Anything?
I don't know that any committees have met since the last time we met.
Do you want to, does anybody want to report on the fire meeting, the fire commission meeting?
Go ahead, Linda or Bill. Or Teresa. Sorry.
Oh, sure.
Okay, you know, like I'm functioning at the best level I can function right now.
All right, I'll just put in my 2 cents. The committee did meet, and the commission does actually have a lot of work just to finish, just to kind of wrap things up. I don't know about an upcoming meeting or a date of our next meeting yet. But I will say that I'm very happy that most of the people that have been serving on the Milton City and Milton Township Fire Department and EMS Department have also decided to move on and be a part of the district. And I do want to just encourage everybody that we still are looking for a name for the district. So put your heads together and think of something that makes you think of our emergency service for this district.
All right, thanks, Linda. Staff reports. Who wants to go first and talk really loudly into your microphone? Okay, we'll start with Kelsey.
We're just working through, well, Rock County's working through tax collection for us. But other than that, just working on year end now, entries and everything to finalize the year and see where we're at. So
Thank you very much. Inga?
We are starting the process of performance evaluations. We contracted with NeoGov, the same module that we're using for applicant tracking. We're using them for performance evaluations. We did our first round last year, and this is going to be our second round. And you'll be likely getting emails soon for your part in the city administrator evaluation. So be on the lookout for that, and we'll provide a little bit more detail as we get closer to it.
Thanks. Chief?
Next week, we have our initial meeting with our mental health provider that is going to provide our annual wellness visits to our staff. They're coming here to just do a presentation about what a wellness visit is and what it isn't. And we've already started scheduling staff. We hope to have everybody done within January, February time, and in order to get them done early in the year, and hopefully it'll be an annual thing going forward.
Thank you. Ashley?
We have our annual community survey out there right now, so if you have 10 minutes or so, please take time to let us know how you use the library in the last 12 months and feedback on our services and programs.
And is that on like the library website?
Yep, it's on our website, it's on Facebook, it's on Instagram, it's everywhere.
So there's no reason why everybody in the community cannot fill out that survey.
Correct, yes. And we would like to know too, like why people don't use the library too.
Awesome. Jenny?
Okay, I'm gonna try and talk louder. So today was the deadline for the spring election candidates submitting the candidate forms, and so we had, in order the people that put all the information in, submitted the forms, we had for Judge Chris Keffler, Mayor Anissa Welch, and Tom Chesmore, and then Alderperson it was Bill Wilson, Nancy Lauder, Teresa Roosh, and Charlotte Walker. So at this point we don't need a primary. And then on another portion of it, we did receive a $1,200 election security sub-grant. And so it's very particular what you're able to use it for, so we decided to use it for hardware. And we are going to be purchasing new computers that will be used in the room here. So I think that will be very exciting. And then also on the alcohol side of things, that Maggie sent out that the Rock County Rock County is putting together a Wisconsin Alcohol Policy Project seminar on Wednesday, January 25th, and it's going to be from 8:30 a.m. to noon at the Resource Center in Janesville. So if you're interested, I will go ahead and be sending information about that out to register.
Thank you. Al?
In terms of the fire department transition, Chief Pickering and myself, Brian Meyer, Anissa, and at times Kelsey will be meeting weekly from now until at least the end of February to kind of stay on top of that. So don't anticipate any kind of craziness that will appear over the next 60 days, but trying to kind of maybe tighten up some of those things that Linda was referencing. The Fire Commission had a very large agenda a couple of weeks ago, and I think in Randy and I's opinion, the vast majority of that stuff can just be dealt with. So we'll be working through that hopefully over the next couple of months. And the other item on Friday of this week, we'll be meeting with an entity that provided a ordinance diagnostic for us as we continue to look at our ordinances and unearth little gems in there. And it's been great to have Jenny and Mark Langer come and with outside experience and look at our ordinances. And we've been talking about updating our ordinances for a long time. So they provided an overall review of our ordinances, and we're going to meet with them on Friday to talk about potential next steps. So that would be a pretty massive undertaking in 2023 if we decide to do a full overhaul of our ordinances, but that might be the least painful approach. So stand by for more information on that.
Can I ask a question about that? Are we also going to be including the zoning ordinance?
All ordinances.
All of them?
Yep.
Okay, thanks.
Milton is very similar to many, many other communities that lots of ordinances that have been created or modified or originated in the 60s, and they're problematic when they're not concise and easy to follow. And we really, we are at a point, and it probably should have been done 10 or 15 years ago, but we really need to modernize our ordinances. It's about making sure that we treat everybody fair and equitably, and everybody understands the ordinances, and then there isn't like a level of frustration in the community if they all of a sudden find out we have an ordinance that we didn't know we had, or we need an ordinance that we didn't know that we needed, and just really continuing to be progressive and adapting to what our community needs. So it is a big undertaking, and it's really super complicated, but just because it's hard doesn't mean that we shouldn't or we aren't obligated to do it. So more to come on that, and I just want to thank everybody for tonight and participating in the training, and I won't see you in 2 weeks. I won't see you in 2 weeks. So Wild and Crazy Larry is he is not only going to be leading the Pledge of Allegiance, he's going to be leading the meeting. So I will see. Prepare yourself. And the team building. And so Larry will be sending out a reminder of team building. I suppose since I won't be here, you can just switch up the agenda and make some policy to never do team building again.
You can lobby for changes.
Larry, since he's not running for re-election, is open to being lobbied. So I will see most of you in a month. Congratulations to everyone that has their name on the ballot, and Happy New Year, everybody. Having said that, just so I don't skip anything, as I've been known to do, your next meeting date is January 17th. And is there a motion to adjourn?
So moved.
Second.
All those in favor?
Aye.